In this lecture, we are going to discuss Varicella Zoster virus, the most important agent of the two diseases, chickenpox and the shingles. So let's get started. First of all, we will look at the structures of the Varicella Zoster virus. It is actually an envelope virus. Inside the envelope, you will see the presence of the capsid that is actually made up of protein. And inside the capsid, you will see the presence of the double-stranded DNA molecule. Okay, this is the general structure of the Varicella Zoster virus. So it actually causes two diseases, varicella or you can say chickenpox, zoster or you can say shingles. Varicella is basically a primary disease. It will happen first times ever in your life and it is mostly seen in the children. But the zoster is basically the recurrent form of the varicella, and that's why it actually happens later in life in adulthood. Okay, if we look at the transmission, you will see varicella zoster virus transmit through the respiratory droplets from one person to another, and it can also be transmitted through the direct contact with the lesions of the varicella zoster virus, because that virus is present in the lesions. Okay, if we look at the replication, you will see the two most important cycles of the virus, lytic cycle and the latent cycle. In the lytic cycle, if you see, the virus will affect the cell, okay, and after that you will see the formations of the different replica of the virus. That is actually the lytic cycle. And next is the latent cycle. In the latent cycle, you will see varicella zoster virus become latent in the nucleus of the neuron. So, in the neuron, you will see the most important component, that is axon. In normal process, signal transmits from the cell body towards the axon. Okay, that is the signal flow from the cell body towards the axon. That process is actually antegrade axonal flow, but reverse will be retrograde axonal flow. That is the important thing. From the cell body, you will see that flow is actually the antegrade axonal flow. Reverse will be retrograde axonal flow. Okay, and after that VZV varicella zoster virus become latent in the nucleus of the neuron. Okay, next if we look at the pathogenesis, first of all, the varicella zoster virus enter in our body through the respiratory droplets. It will go towards the upper respiratory tract, and from the upper respiratory tract you will see that virus will go in the blood stream, and after that you will see that virus will form vesicular rash on the skin. This is mostly seen in chickenpox. That is actually the primary infection. In the chickenpox, you will see the formations of the vesicular rash. Okay, but after that, this virus can become latent in the neuron. Okay, that virus will go retrograde axonal flow and become latent in the dorsal root ganglion. That is the latency site of the varicella zoster virus. And when that virus gets some stimulus like the local trauma, and as a result you will see that virus again move antegrade wise and form lesions on the skin. That will forms the shingles. Shingle will produced after the latency of the varicella zoster virus. So chickenpox is basically a primary disease and the shingle is actually the recurrent form of the chickenpox, or you can say varicella. Okay, if we look at the manifestation, first of all we will look at the varicella or you can say chickenpox. You will see after the incubation of 14 to 21 days, you will see the prodromal symptoms. You can see the fever and the malaise. After that, you will see the formations of the papulovesicular rash. There are the different stages of the rash. First of all, you will see the formations of the papule. After that, you can see the formations of the vesicle, then pustules, and then crust. That is actually the recovery form of the rash. And it can be seen on the trunk, and from the trunk, it goes towards the extremities and the head. And you can also see the pruritus, itching on the rash as well. So here are basically the different manifestations of the varicella or chickenpox. But if the children is affected by the varicella, and if someone give aspirin to the children, I'm saying if we give the aspirin to the children who is actually affected by the varicella, then you can see another syndrome, that is Rye syndrome. Okay, and as a result, you will see the encephalopathy, and the liver degeneration. That is actually the Rye syndrome. I repeat, if the children is affected by the varicella zoster virus, and if we give the aspirin to that children, then it can go towards the Rye syndrome. In the Rye syndrome, you will see the two most important manifestation. First is the encephalopathy, and second is the liver degeneration. So these are basically the different manifestations of the Rye syndrome. So that's why we don't give aspirin to the children who are affected by the varicella zoster virus. Next is the manifestation of the zoster. You will see the painful vesicles, and vesicles will form on the sensory neuron pathway, specifically on the dermatome. Okay, that is the important thing in the zoster virus. And you can also see the post herpetic neuralgia, neuropathic pain in that case. Neuropathic pain. Okay, and for the treatment of the neuropathic pain, you can give the gabapentin or lidocaine patches for the post herpetic neuralgia. Okay, these are basically the manifestations of the zoster, or you can say shingles. If we look at the lab diagnosis, so you can go towards the PCR of the viral DNA. You can also go towards the DFA, direct fluorescence antibody test for the varicella zoster virus. You can also go towards the Zhang smear. We will take the cells of the lesions, and after that we will look it in microscope, and we will see multinucleated giant cell, and inside the cell you will see the inclusions body. Here is the multinucleated giant cell. Here is the giant cell having many nucleus, and inside the nucleus you will see the inclusions bodies. So that is actually the Zhang smear. And you can also go towards the serology, in which you will detect the antibodies against the varicella zoster virus. If we look at the treatment, so in the treatment plan, there is no specifically antiviral therapy for the immunocompetent patient, but we can use the acyclovir to reduce the severity of the symptoms. Okay, that is acyclovir in the varicella and the zoster. And for the preventions of the varicella zoster, you can go towards the vaccine. For the varicella, you will see the Varivax, and for the shingle, you will go towards the Shingrix. So these are basically the two vaccines. Varivax, that is live attenuated, and Shingrix is basically the glycoprotein of the virus. So here are basically the two vaccines against the varicella zoster virus. So this is all about the varicella zoster virus. If you still have any question, you may ask in the comment section. Thank you so much.